Welcome to our comprehensive guide on ankle joint mobilization techniques. In this video, we'll explore the anatomy, types, and key movements of the ankle and foot joints, focusing on practical mobilization methods used in physical therapy. Whether you're a student, practitioner, or simply curious about joint health, this journey will provide you with essential knowledge and hands-on tips. Let's begin by understanding why ankle mobility is crucial for daily activities, sports, and injury recovery. We'll start with the lower tibiofibular joint and progress through the ankle, subtalar, and midfoot joints. Get ready to enhance your understanding and skills in joint mobilization. Let's dive into the lower tibiofibular joint, starting with caudal gliding. The patient lies supine, and the therapist stands at the foot end, facing the joint. Using the right hand, the therapist fixes the medial malleolus, while the left hand grasps the lateral malleolus. The right hand then glides the medial malleolus downward, or caudally. This technique aims to increase joint play, reduce pain, and improve ankle dorsiflexion. Proper fixation and stabilization are key to ensuring effective mobilization and patient comfort. Mastering this movement lays the foundation for more advanced ankle techniques. Next, we focus on cranial gliding of the lower tibiofibular joint. The patient remains supine, with the therapist maintaining similar hand placements as in caudal gliding. This time, the therapist's right hand glides the medial malleolus upward, or cranially. The goals here are to further increase joint play, alleviate pain, and enhance ankle dorsiflexion. Consistency in patient positioning and therapist technique ensures optimal results. Understanding both caudal and cranial gliding prepares you for addressing various mobility restrictions in the lower leg. Understanding the ankle joint's anatomy is essential for effective mobilization. The ankle is a synovial hinge joint formed by the distal tibia, medial and lateral malleoli, and the talus. The articular surfaces include the concave tibia, flat malleoli, and convex talus. Key ligaments medial, lateral, anterior, and posterior provide stability. Recognizing these structures helps therapists apply mobilization techniques safely and accurately. This foundational knowledge supports all subsequent hands-on interventions, ensuring both efficacy and patient safety. The ankle joint allows two primary movements: dorsiflexion and plantar flexion. Dorsiflexion is powered by muscles like tibialis anterior and extensor digitorum longus, while plantar flexion involves the gastrocnemius and soleus. Arthrokinematically, dorsiflexion involves dorsal gliding, and plantar flexion involves ventral gliding of the talus. Understanding these movements and their muscular control is vital for targeted mobilization and rehabilitation. This knowledge also informs the selection of appropriate techniques for improving range of motion and function. Distraction is a fundamental mobilization technique for the ankle joint. With the patient lying supine, the therapist stands at the foot, grasping the talus and calcaneus. By applying a downward pull, the therapist separates the joint surfaces, increasing joint play and range of motion while reducing pain. This technique is especially useful for stiff or painful ankles, providing a gentle yet effective way to restore mobility. Proper hand placement and controlled force are crucial for patient comfort and therapeutic success. Dorsal and ventral gliding are essential for restoring ankle flexibility. For dorsal gliding, the patient lies supine while the therapist glides the talus dorsally to enhance dorsiflexion. For ventral gliding, the patient lies prone, and the therapist glides the talus ventrally to improve plantar flexion. Both techniques help increase joint play and reduce pain. Mastery of these gliding movements allows therapists to address specific mobility deficits and tailor interventions to individual patient needs. The talocalcaneal, or subtalar, joint is crucial for foot inversion and eversion. Inversion is achieved by medial gliding, while eversion uses lateral gliding. These movements are supported by ligaments like the interosseous and cervical ligaments. Mobilizing this joint helps restore normal foot mechanics, especially after injuries like sprains. Understanding the anatomy and movement patterns of the subtalar joint is key for effective rehabilitation and pain relief. The midfoot's Talonavicular and Calcaneocuboid joints play a vital role in foot flexibility and shock absorption. The Talonavicular joint, a ball and socket type, allows for dorsal and plantar gliding, aiding inversion and eversion. The Calcaneocuboid joint, a saddle joint, also enables these movements. Mobilizing these joints improves midfoot mobility, reduces pain, and supports overall foot function. Therapists use specific hand placements and gliding directions to target each joint effectively. Moving forward, we address the tarsometatarsal and intermetatarsal joints. These joints are essential for distributing forces during walking and running. Mobilization involves plantar and dorsal gliding, with the therapist stabilizing the tarsal bones and moving the metatarsals. This technique increases joint play, enhances flexibility, and alleviates pain. Proper mobilization of these joints ensures smooth foot mechanics and prevents compensatory movement patterns that can lead to further issues. The Metatarsophalangeal, MTP joints, are critical for toe movement and balance. Distraction, dorsal, plantar, medial, and lateral gliding techniques are used to increase joint play, improve range of motion, and reduce pain. The therapist stabilizes the metatarsals and mobilizes the proximal phalanx in the desired direction. These techniques are especially beneficial for conditions like hallux rigidus or after toe injuries. Consistent practice of MTP mobilization supports healthy gait and foot function. To wrap up, mastering ankle and foot joint mobilization requires a solid understanding of anatomy, movement, and technique. Each joint from the lower tibiofibular to the metatarsophalangeal plays a unique role in mobility and function. Consistent practice, attention to patient comfort, and proper hand positioning are essential for effective outcomes. Remember, these techniques not only restore movement but also prevent future injuries and support overall lower limb health. Thank you for joining us on this journey to better ankle and foot mobility. Stay tuned for more practical guides and keep practicing your skills.